That's it. And number 11, and Alex Celsius.
Here.
Oh, well, number 10 then. Number 10.
There are many explain of people with learning disability and also in the hospital.
Yeah.
I'll
read them.
Okay.
There are many examples of people with learning difficulties being ignored in hospitals and not receiving the same standard of care. How are you going to make sure people with learning difficulties are taken care of properly in hospital?
Very briefly again, once again, candidates. Elizabeth.
Thank you. Yeah, it's all about communication and it's all about training. And it's the same, very often you hear an elderly person saying that why is it that when I go into hospital, people actually shout at me. I've come in about my knee, I'm not deaf. So it's about communicating with you, and that's a vital part of training, whether it be in any walk of life. So that's the issue. It all goes down to training, and that needs to be in the training plan. Communication, vital. Thank you.
Ellen Jones.
Well, I'm really sorry to hear that that people with learning difficulties are treated differently in hospital. I would hope that in hospitals that we have in this constituency, in Bronglaes and even in Tregaron and Cardigan, that wouldn't be the case. I know that staff there work hard and are very caring in this area. But it is, as Elizabeth has said, that we need the staff in those hospitals to be communicating in a way where the patient understands the issues that are being raised with them. It's not always just an issue for people with learning difficulties. There are others who fail to understand some of the communication from doctors, and doctors in particular possibly, when they're moving around the wards too quickly and not taking enough time with the patients. But certainly the staff at our hospitals need to be fully aware that they need to be communicating well with their patients so that everybody understands what their care is.
Thank you. If you would like to leave, if you wish to leave, Ellen, that is completely fine. We are going to go over. We do have another handful of questions. Yeah, if you do need to go,
yes, thank you. Alex can't be here. He's working today. Alex is the chair of the Ceredigion Parents and Carers Forum. His question is, there is little in the county post-16 for young people with disabilities. Funding has been cut by the Assembly for colleges, and at the moment some young people are being taxed at great expense to Carmarthenshire. Because of the drift of local provision, residential specialist colleges are preferred. Getting funding for these placements has become a nightmare for both the transition key workers and Career Wales, as Wales, unlike England, insists on multi-agency funding, the Assembly, NHS and local social services budget. The problem is every agency wants the others to meet the cost. So how would you put this right?
Elizabeth?
Wow, that was a big question. Right, yes. In this instance, we do need to follow England. It's an absolute nightmare. The deliberations that go on between health and social services, arguments over packages of funding. There are elements of social services that firmly need to be in health, and there's no doubt about that. Regarding multi-agency, yes, it is a bureaucratic nightmare. I didn't realise, actually, that they were going to Carmarthenshire for some services. I know, for instance, there is no dementia nursing care in Ceredigion, no Alzheimer nursing care in Ceredigion. It's costing the local authority thousands to obviously place residents out of county, and it's cruel. It's cruel for families. There should be more provision in Ceredigion, there's no doubt about it, because it would simply, if you're talking about money, and we are talking about money, it would be cheaper if we had the services here. Again, it's political will, and something fundamental needs to change between that relationship between health and social services. I don't know if that answers your question, but I do recognise there is a big problem. Thank you.
And Luke.
Well, thanks. Well, again, that is a huge question, and to be honest, I'd like to have the opportunity to have that in writing so that I can look into that at length. I feel that what we need to be doing is cutting the bureaucracy to have greater and clearer guidance on that discrepancy. And also, I think in terms of living in a rural area, we need to have a particular scheme for dealing with these problems in rural areas, because the problems that we face here are completely different from in an urban area where facilities are much closer together. So, I mean, if I could have a copy of the question, and then hopefully I can give you a much more satisfactory answer than that. Thanks.
Roger, do you want to ask Alex's second question?
While I've got the mic, I think I could manage that. Okay, Ceredigion got funding for a transition pilot, and now they, like other counties, have transition funding. Transition to adult services has been a problem here, as in other counties. One of the big problems is that Tim Plantanable has done an assessment for the child required by the Assembly, the ICS, Integrated Children's System, and then the transition workers do an in-depth assessment, PCP, person-centred planning, looking at what is and what is not working. But then when they reach 18, they are transferred to the adult team who has just met this person with additional needs, and they must do a third assessment, UAP, Unified Assessment Process, to get any funding. What would you do about this? They would like a unified process, but it must come from the Assembly.
Are you ready, Luke?
I don't know why I write these things down, because I can't read my writing. No, what it's got to be about is cutting out the bureaucracy, and I would support a unified system. What is important is that everybody feels comfortable with the way that they're being dealt with, that you deal with the same faces that you see all the time, and that you're taken through the steps. So I didn't realise just how bureaucratic the system was, but we need to be ensuring that you're dealing with the same people all the way through the process. And I will, pledge my support to a unification process. So again, if I could have the full details of that question, then I'll take that up for you. Thanks.
Thank you.
Thank you. I go back to that bureaucratic service that we have in Wales, and it comes out of the Assembly, I'm afraid. It is centred in the Assembly. Young People's Partnership in Ceredigion Council has responsibility for children and young people up to the age of 25. So, it should almost be like a passport, an assessment. Yes, it may need updating, but to go from one assessment to another little box, have another assessment to another little box, is completely bureaucratic, costs a fortune to implement, and we need to break down all those barriers. And again, I have to say, we have to lobby, as your questioner said, we have to lobby the Assembly hard on that one, because it's costing a fortune, doesn't help the client at all, and it's bureaucratic. So, thank you.
Yeah, very sorry. We are running late, and we have to limit the questions. But those who haven't asked the questions are welcome to email the candidates or speak to them over lunch if they do fancy a little bit of lunch with us. And last question now is from Jenny Thomas, Parents and Carers. Is she here?
Yes, unfortunately Jenny can't be here either, due to caring issues. So I'll ask for Jenny. What provision, if any, do you feel may need to be in place in education for children with Asperger's in county? And what is available, and what is available acceptable? Thank you.
Yeah. Elizabeth?
Thank you. I can only speak for Aberrine Comprehensive School. Obviously, this is my hometown. I know that they have an area called Hafan and Enkil. They have one-to-one support. I can't comment whether or not that's enough. For some, it's obviously not. But the most important thing for me, the basic fundamental for me, is that all young people with learning difficulties are integrated into our society, and that includes our school system, and they should be given the funding and they should be given the full support to be integrated. If that's not the case, if there is a greater need that the local authority, that the education department are not be able to meet, then we need to seek, obviously, service elsewhere. But as far as Asperger's is concerned, you know, we have facility. I don't know if it's in every comprehensive school. I'm not sure. But for Aberrine, I know there's one-to-one support, and that Hafan and Enkil, those departments. I don't know if that helps. Thank you.
Finally, Luke.
Thanks. Well, I believe that is the situation in the vast majority of schools. I don't know whether there is any legislative framework to make sure that is the case. But I mean, the Welsh Conservatives support direct funding to schools. What we want to do is to give schools more power over their budgets so that they can work on issues like this with parents, because we believe that parents, teachers, governors know what is best for pupils on the ground with varying needs. So I agree fully with Liz in terms of that we need to be ensuring that people with Asperger's, people with all sorts of disabilities, are fully integrated into school life and have the best possible opportunity in education.
Thank you. I can open the questions to the floor now for 5 minutes, and 5 minutes only. Is there any? No? Yes. You're quite happy to have a chat over lunch with our candidates. So that is our hustings for today. Can I express my best wishes throughout the election campaign to both our candidates, and yes, thank you, and I thank you all for your questions. We want to be a solution of the problem, not the actual problem itself, and thank you for you three today for actually seeing us as the solution and not the problem. Yes, so thank you.
So, just before we all go to lunch, I just want to thank you for the opportunity. I mean, we really do appreciate it, and also to thank Jonathan here for a sterling effort to do that. I mean, both Liz and I don't like getting up and speaking in front of people. What I find is that when I talk and stand up and talk to people, is that my left leg starts wobbling around like that because I get so nervous. So it's so difficult to do that. So I really think we should be thanking Jonathan for a great effort.
Thank you.